Okay, so in this video, we're going to be talking about attachment theory and secure attachment and the difference between the two and some ways for you as a parent to ensure that you have good attachment with your newborn. So the attachment theory is basically the theory that when a baby is born, the attachment process starts, and it's not an automatic attachment, but it's actually something that happens over a length of time. So usually between the time the baby's born and the first 6 weeks, the baby is going to be mainly attached to the birthing person, the person that they're nursing off of, or the person that's feeding them by bottle. And they will begin to form that attachment. There's a lot of theories out there that because babies' main focus at that age is oral, that they are mainly attached to the person that's feeding them. So that would make perfect sense. So as they begin to form that attachment, their bond will begin. So with a parent that is a partner, that bonding process or attachment doesn't always happen right away, which can be kind of surprising for partners of the birthing person. So that will happen as time goes on, and it's okay to know that it will happen, and it's not going to happen right at this moment because the baby has other needs. So over time, over the course of the year, the baby will attach to the person, typically the person that they're nursing off of. So let's use that as an example. So the birthing person birthed the baby, they attached to the person that is now they're nursing with. And over the course of the year, if that person isn't around, most likely they will attach to the partner. And then over time, after you get past that, 12 months to 24 months, then that newborn baby toddler will begin to form attachments with other people around them, such as aunties and uncles and grandparents, close family friends. So it's kind of how that's kind of an example of what the attachment theory is. And as your newborn begins to form a secure attachment, is another term we're going to be going over. That is when the attachment process has happened and it's really secure. And you know it's secure that when, for example, when the child feels really unsafe or gets hurt, who are they going to run to? They're going to run to the person that they're most attached to. So most likely their parents. If that process didn't happen and there's struggles between the newborn, the child and the birthing person or the parent, whoever they attach to, when they get hurt or they feel scared, they might not run to them. They might run to someone else. So that's an example of that. Ways to make sure that you have a good attachment with your newborn and that the bonding process can begin is really spending time with your newborn. You hear in the hospitals that they typically don't really have a nursery anymore. They want the babies to room in with them. They want them to stay in the room with the person that they are going to be attached to. They don't want them to leave. So in a home birth setting, the baby's going to come out and the baby's going to go right on the chest. We're going to do lots and lots of skin to skin. And when that parent needs a moment to go to the bathroom and eat and take a shower, change their clothes, the newborn is then going to go directly to the other parent or partner in the room so that they can start that process. They're there. The child's going to know that they are there and that they feel secure by them, but the attachment process isn't quite happening between them yet. It's really with the birthing person. So yes, lots and lots of skin to skin, and the partner is really going to be a source of, like I kind of just said, making sure that the birthing parent has the freedom to take care of their mental health needs, because it's proven by ACOG, or ACOG suggests that if the parent that is the primary caregiver of the newborn isn't okay, then the bonding process can be a lot more difficult. If they are emotionally exhausted, physically exhausted, not eating, not drinking, haven't gotten to use the bathroom, haven't gotten to shower, haven't gotten to change their clothes, then their focus is often on all those other things that they haven't been able to do and not on the newborn and the bonding process. So for partners, it's really important that you, as a second caregiver, are really, really there for the person that's the one that's primarily taking care of the needs of the newborn. So I think that's a couple more things. Reaching out to your community can be really helpful in the bonding process. The more stress you can take off of yourself. So doing meal trains, having people come over and clean your house, do laundry for you, take older siblings if you need time to sleep or just be with your newborn. All of that can be extremely helpful, and it's really important that you reach out to your community. And in relation to making sure that this evolution and adjustment is happening, you can always check in with your provider. Your midwife should be aware and should be paying attention as they come and visit you in home to make sure that you are forming attachments and that baby isn't kind of off in the other room with a grandmother when they're only a couple days old, and they really should be on your chest. So your midwife can provide you with a lot more support if you feel like, I don't think this is happening, or I don't think I'm doing something right. Yeah, she can provide you with a lot of suggestions, such as skin to skin, making sure baby is not leaving the room, making sure if you do need something that baby is with your partner, so that process can kind of start too. So I believe I touched on all the things. Let me know if you have any questions, and I'd be happy to go over that with you.